What a scary name. Indeed, the disease is so scary, but thankfully enough, it is very rare. Hello and welcome to the channel. This is Dr. Skanda. Today, let's look at this condition which is making headlines in Kerala, that is brain-eating amoeba. The culprit is a free called as Naegleria fowleri, which is a free-living amoeba which usually is present in the warm fresh waters of lakes, ponds, rarely rivers, or even poorly chlorinated swimming pools. Well, they usually feed on bacteria, but if they're in the mood and if they're inside the body, they even eat our astrocytes or the neuronal cells inside the brain. Infection it causes in human beings is called as primary amoebic meningoencephalitis or PAM. It's also called as naegleriasis. How does this infection occur? So when the water contaminated with these amoeba get into the nasal cavity, either by swimming or diving or sometimes nasal irrigation using this contaminated water, what happens? This amoeba gets into the nasal cavity. It gets inside the nerve cells in the nasal cavity, that is the olfactory nerve roots, and then it goes through the roof of the nasal cavity called as the cribriform plate. It passes through that and then it enters the brain. Once it enters the brain, it starts giving all the problem. As I told previously, they can eat on the astrocytes or the nerve cells which are present inside the brain. So obviously they keep damaging the brain cells. It's also interesting to know that swallowing this contaminated water causes no problem at all. It's only when it is aspirated into the nose that it causes all these problems. Well, this disease actually presents a lot of diagnostic challenge to the medical fraternity. Why do I say that? Because the initial phases it is impossible for anyone to suspect this disease. Once the patient is exposed to this amoeba in the nasal cavity, it takes about 1 to 12 days for the symptoms to appear. Roughly around 5 days is the median period. And the initial symptoms are just like any other flu-like illness. That is, the patient may have fever, he may have generalized muscle pains or sort of cold kind of sensation. But as the days pass, then the patient will have symptoms specific to meningitis. But again, when the patient has symptoms suggestive of meningitis, that is headache, nausea, vomiting, neck stiffness, and when the patient is presented to the clinician or the doctor, obviously the doctor will initially suspect viral or bacterial meningitis, which are more common, and won't usually think of this naegleriasis unless there is a specific history that the patient or the bystander gives that the patient was exposed to the contaminated water few days back. So if these symptoms persist, then obviously the patient is going to have much severe forms of symptoms. That is, he may have visual disturbances, he may have confusion, imbalance while walking, or all sorts of problems which may later lead to seizures, coma, and eventually death. Once the symptoms begin, it usually takes about 2 weeks for the patient to die. So how is this supposed to be diagnosed? So for any reason, if the suspicion is high, that is, if the patient clearly gives history of getting exposed to contaminated water, then lumbar puncture is done where the CSF is obtained and amoebic culture can be done, or PCR to look for the DNA can be done. But this is usually not available in most of the centers and requires a tertiary laboratory for the same. Well, how to treat it? So as I told previously, first of all, the biggest challenge is to diagnose it. And in case if it is diagnosed, then different drugs are tried in the treatment. Most important being amphotericin B, which is basically an antifungal, but it also acts against this amoeba. Other drug called as miltefosine is an anti-parasite, which is also being developed and tried in the treatment of these. Along with these specific treatments, obviously other supportive measures in the form of dexamethasone and other medicines will have to be given. But unfortunately, in spite of giving all these medications, the sad reality is that 97% of these patients who are infected with naegleriasis end up dying. So when the mortality is so high, just like rabies, the most important part of it is to prevent it altogether. So how can we prevent it? So we need to prevent it by preventing the exposure to that amoeba, which means avoid swimming in a dirty, contaminated, stagnant water, avoid using such water for nasal irrigation, use a well chlorinated swimming pool instead. And another important thing is to educate people, educate children, make them aware of the potential problem it can cause. Well, this is making headlines in Kerala. Unfortunately, 3 minors have lost their lives to this deadly amoeba, and the 4th case is reported recently. So please stay informed, take precautions, prioritize your health, and if you found this video informative, make sure you give it a thumbs up and share it with those who are fond of swimming. Thank you for watching.